Hi, my name is Olga. I'm going to be performing the skills video of IV fluid and medication. Before I start off, I have all the works worked here. We're going to give the patient fluid and then medication. Talking about, I did all the work here. So for the fluid, we're going to give 150 milliliters per 60 minutes, 15 drops per milliliter. It's going to equalizing to 38 drops per minute. For the medication, we're going to be giving amoxicillin, 250 mils per 100 milliliters. It's going to be 100 milliliters per 15 minutes, 15 drops per milliliters, and that's going to equalize to 100 drops per minute for the medication. Before giving any medication to my patient, I want to verify the physician's orders, and I want to go over the 6 rights of medication: right patient, right medication, right dose, right drug, right route, right time, and right documentation. Next, I'm going to hand hygiene and put on my clean gloves on. And we are going to go over the tubing. We have primary and secondary tubing, the 15 factor, and then another 15 drop factor. Next, I'm going to talk about the tubing here, the primary tubing. So we have a spike end here, and then this is where we connect the medication. We want to keep this sterile until we get started. And then we have the chamber, the drop chamber. This is where we fill out up the air. And then next we have the we have the roller chamber here, the clamp, roller clamp. And this is where we adjust to get the fluid out. And then also we have the Y port here. This is where we connect to push medications, or we attach the secondary tubing here. And then next we have the adapter here, and this is where we connect the patient to the IV. And then same thing with our other tubing, the secondary tubing. We have the the end clamp, the spike end. We have the drooping chamber. We have the roller adapter. And then we have, the difference with that one is that we have a piggyback rope where we are going to connect this to the adapter that we're going to connect to our secondary chamber. Okay, so before giving any medication, we want to check the physician's orders. We also want to check to make sure that the patient doesn't have any allergies in their chart. Also, we want to make sure we, like I said, verify their orders, and we're going to get started. So first, we're going to start with our primary tubing here. We're going to take this spike off here. And then we're also going to take this portion off too. And we're going to just make sure that we clip it inside here. And we want to make sure that this is closed so we don't have anything coming out. We're gonna put it under, and we're going to put it on the wall here. Okay, that's on the wall now. Next, we're going to make sure that we fill this up halfway. We're going to fill it halfway. We're going to prime it. And next we're going to prime it. So we're going to make sure that the fluid goes in there. A couple drops, so it'll be good. Just to get the air out. We're going to clamp this, and we're going to go ahead and we're going to count. So the primer rate is going to be 38 drops per minute. So we're going to document that. We're going to look at our watch for 1 minute, and we're going to make sure that there's a good amount. We're just going to adjust this for it to have it drop. It's going to be 38 per minute. Okay, awesome. So I have done that. I'm going to clamp this. Also, we want to make sure that we apply the IV bag 30 inches above the patient's IV site. Next, I'm going to go ahead and we're going to connect the secondary tubing right here. And we're going to make sure that we put a cap on here. Put the cap on. And we're just going to alcohol that Y port. Alcohol it. Next, we're gonna bring this down because the patient needs amoxicillin. And then we're going to go ahead and, if I need to, I'll re-alcohol that. And we're going to connect the piggyback chamber. I'm going to take the cap off here. Connect it to the Y. We're going to take off the spike end. We're going to take this end off. We're going to twist it in. All is twisted. We're gonna put that one above because the patient needs their methicillin. We're gonna make sure this is clamped. We're gonna put an air in here, and we're gonna fill it up halfway. Okay, that's perfect. We're going to prime it and make sure that we get at least 1 or 2 bubbles out. Okay, there we go. Next, we're going to count and make sure that it's a minute. So this one is going to be 100 drops per minute. So we're going to count that. We're going to adjust it. Okay, I have counted that. It's 100 drops per minute. Everything is hooked up here now, and I'm going to apply the cap on. Make sure this is clamped. All right, now that everything is hooked up, I'm going to go ahead and make sure that the patient's IV site is in the proper location, the patient is comfortable. I'm going to clean up my area and I'm going to document my results. I'm going to take off my gloves and I will hand hygiene here. And we are done.